So it's great to be with you here today. One of the key things about the COVID tracking project, which I founded along with Aaron Kassane, Robinson Meyer, and Jeff Hammerbacher back in March in the early and scary days of the pandemic, was that we needed to know data on all of our communities. That meant not just knowing data on people who could afford to get tested, who had access to testing, and who could confirm their cases, but on everybody. And we wanted to know how all of our communities would be disparately impacted. But when we went to go look at data that was available, the basics weren't even there. And that's kind of where the COVID tracking project was born. Rob Meyer and I wrote a story for The Atlantic that basically created a method of coming up with numbers for the nation. We went to each state, we compiled all those numbers together, also Puerto Rico and other places, and we put those together into one big national data set, stitching it together. We created a very simple mission statement that we compiled and published official state and territorial data essential to understanding and responding to the COVID-19 outbreak in the United States. And we started to make calls for volunteers and bring people into the project. It was an incredibly open and porous community. There were experts who, had masters in public health and genomic epidemiologists. We had a great advisory board, but it was really open to all kinds of people, and all kinds of people came in and I do think felt supported in a pretty radically inclusive environment. What we ended up producing was really one of the most respected and widely used sets of numbers. A lot of the things that we tracked, the CDC didn't actually put out for 100 days in one case, in the case of testing, and for hospitalizations, didn't really settle down until November. So for many, many, many months, in a way that we totally didn't anticipate, we were a volunteer-driven data collection service for the entire United States, and it was pretty incredible. We also did a lot of analysis on things like, well, is the data that the federal government's putting out, is it matching what's going out in the states? And territories of the United States. We put out long-term care facility data because we knew that long-term care facilities were a place where many deaths were going on. We partnered actually with Ibram X. Kendi. Some of you may know him from his work on anti-racism, and his team first at American University, and then when he moved to BU, on the COVID racial data tracker. And I want to say, I think in the future, much better race and ethnicity data will come out, but through the early part of the pandemic, there was just this question of like, how many Latinos, how many Black people, who actually in brown and Black communities is getting sick, and how is that different from how many people in white communities are getting sick? And we were able to show very, very, very early on that there were going to be quite harsh racial disparities. One of the things we also learned was how little data actually got collected in some places, particularly like in Texas. In Texas, race and ethnicity data is available for a very small percentage of cases, whereas in other states, even ones that are not known to be wealthy states, like say Arkansas, there was tons of that data available. So one of the most important things we learned is that if we want national numbers, as our beautiful multivalent Latino communities, we actually need all of the states and territories to be working from the same playbook and creating the same kind of statistics so that we can really understand, are Afro-Latinos being affected more than like Chicanos in LA, and it's a really important point that even the categories that we do use can be reductive. In fact, in a lot of cases, basically Latino was treated, or Hispanic was treated as a racial category instead of an ethnicity with a multitude of racial backgrounds. One of the ways that we really went about going this deep was we created a lot of deep data annotations. So we didn't just publish data. The sort of central tension of the project was we published data, and then we published basically critiques of that data or deeper understandings, or we published all of the mistakes. And I think that was crucial for building trust. We were mentioned many thousands of times in the press. We had constant usage on local television stations in English and Spanish. And on the left of the political spectrum to the right, 1,000 citations in academic journals, and used by most of the big trackers like Johns Hopkins, Financial Times, and Our World in Data. Our data was cited by both White Houses that have been in office during this time. The CDC's Vaccine Advisory Council specifically cited our race and ethnicity data. FDA, FEMA, HHS, Department of Defense, the Biden campaign relied on our data and analysis. And a CDC report said that CTP's racial data might be more accurate and complete than that of the federal government. And that was about midway through last year. So the question I keep asking myself is like, why did this work? It really should not have worked. And I have some very simple answers for you. If you're thinking about collaborative and projects working with communities that are affected, there was something to do. Most of the time you don't think people necessarily want something to do, but they do. That work, it happened together. It was easy to learn, but it was hard to master. We used it immediately, and the work was really, really valuable. And that helped build our community up to over 500 people, and also helped us raise almost $2 million to pay staffers who were managing those volunteers. Our big takeaways from this, the lessons that we really learned and the things that we lived by: one, be a force for reality. You want to get as close to the facts as possible. You want what data you're putting out or whatever you're putting out to match up with reality as close as possible, not how you want things to be. Two, increase the speed that their movement to knowledge, no matter what you're doing. Model a culture of gratitude. We had this, specifically thank people for things they're doing, and build value, not just for your own organization or your own people, but build value for the whole network of people who might be using whatever it is that you're doing. Thank you for inviting me to give this lightning talk. I'm Alexis Madrigal. I'll see you later.